This is One-on-One. Recently, my colleague Joanna Gagis visited a healthcare center in South Jersey to see how one approach to healthcare that treats patients like a client can actually improve outcomes and reduce healthcare costs.
We've all stood in line at the pharmacy, awkwardly whispering the prescription that we're there to pick up, hoping that no one around us can hear what we're saying. Well, checking out at a doctor's office can often feel the same way. But here in this practice, patients check out with a nurse right in the privacy of their own room. Here at Virtua Medford Medical Center, a patient's need for privacy was just one of several factors that led to the redesign of this healthcare center in South Jersey. Dr. Kapoor, tell me how you first had the idea to reform this medical center here in Medford.
It's been an evolution of concept. Right? We've been providing medical care a certain way, a certain style for decades. But then you started thinking about concepts of form follows function, that you want to design spaces that support the work that's been done in our practices for a number of years. So then I was walking through the mall and I walked into an Apple store. Right? And it's what a different experience. The moment you walk into an Apple store, you're greeted by a person who helps guide you in the right direction. You still have the ability to go walk through yourself, but you also have someone who's immediately there to help to guide you to the next step. So we say, if Apple can do it, why can't we in medicine try something along those lines?
Plenty of people walk into an Apple store and don't take that experience and turn it into something meaningful for themselves, for their practice, for their customers. What in healthcare has changed over the last few years that is kind of leading us to the path of saying, let's stop and analyze how we do things and figure out ways to do it better?
We're in such a unique place in healthcare right now, more so than ever before. Our patients are also consumers. And the right thing to do is to sit down and sit with our patients/consumers and understand what's going through their mind. Coming to the doctor's office is not a big deal for those of us who work here every day, but it can be anything but routine for those who are coming to see us. They're maybe coming in for something a little bit concerning, than an abnormal x-ray or an abnormal lab test, and then they need to sit down and talk about it. So again, how can we help design spaces that allow and foster those conversations in a comfortable area, in a safe environment, in a quieter environment?
In that spirit, guests who arrive here are greeted at the door and ushered to their destination, to the urgent care center, to their primary care physician's office, or to one of the specialty service offices.
When I came in, you get greeted by someone at the front desk. They check you in. They bring you to the back waiting area. When you walk in, it's very comfortable, relaxing. The atmosphere is very calm. There's a lot of space, a lot of privacy.
The primary care offices in particular have undergone changes that are meant to improve the doctor-patient experience. Each room has a conference table where the doctor sits and talks to the patient before the exam even starts.
This table makes you feel so personal and such a normal conversation you're having with the patient. I feel like it makes me listen to them more because we're sitting and talking to each other. It slows me down for a second so I can listen to them and not just jump in because they're on the table and start examining them, and I feel like I give better care because of that.
It makes it more personal, first of all, that's for sure. Traditionally, you're speaking to your doctor while you're up on the table and she's standing up, and now, you can actually sit down and have a conversation one-on-one at a table.
Problems with any of your meds?
If the patient consents, the doctor will bring in a scribe to take notes during the visit, allowing her more face-to-face engagement with the patient.
I've had people say to me that before the scribe that they felt like I was just looking at the computer and not looking at them because you have no choice.
What are you doing on that computer?
Well, you're documenting everything they're saying. If you don't document it at that time, you're not going to remember what they said. And you're thinking about all that while you're also trying to actually take care of the patient, which is really like the main thing you're there for.
So how are you able to better think and concentrate with the scribe?
I don't have to worry about the computer at all. I actually have a computer in front of me too, so I can use that time if I need to look at their test while I'm talking to them. I can think much more accurately when I'm not worrying about typing and documenting and navigating screens.
Perhaps the most significant change is the new structure of the office, with an open-air nurses station in the center and exam rooms built around it.
They showed us this plan, and we were all very skeptical. Everything is open, everybody can see everything. We're all worried about things like the chaos and the noise that would go on. You know, you really, when you walk out of a room and you're a physician, you saw a patient, honestly, there's millions of things often going on in your head that you need in your head until you get done the visit and get everything in the chart. And so we were all worried that when we would come out of the room, they'd be coming and asking us this and coming and asking us that, and, you know, distraction, and we just wouldn't be able to concentrate. But amazingly, that does not happen. Everybody's doing their job. We were worried about the general noise level, but amazingly, that it doesn't get noisy. We were worried about the view of the patients coming out of the room, that we would get, you know, distracted by them talking to us after they came out of the room. But one, they don't do that. The other is the in-room checkout, which is another new concept we had. Saved us from that too, because by the time they're leaving, you're actually already in the next room.
Hi, James. How are you?
Good, how are you?
The in-room checkout also lets patients ask the discharging nurse any sensitive follow-up questions they may have without worry that other patients can hear them.
I think it's a very good attribute to this office that the nurse comes in and, you know, goes through all the things that the doctor spoke to you about in a privacy setting.
People are much more compliant with care if it's easy. So here at this facility, we offer primary care, we offer urgent care, and then we have one specialized office area, which is cardiology. Then we also have a general lab here, so if you were sent for just some fasting blood work, or if you need to have your blood levels checked, you can have that done also.
Do you find that outcomes are improved when access to care is improved?
You do. If you make it easier, and if the doctor knows that they can send you down the hallway for whatever service it is, most likely you're going to go. Where if you have to leave and go somewhere else, there's a chance that you might not.
It's so interesting. So many people who don't have health insurance or don't have a primary care physician, we're using the emergency room.
Right.
By bringing them into the urgent care facility, how do you reduce costs, especially because that facility is shared with the primary care office?
Not every injury is an emergency, or not every illness is an emergency. Urgent care is much more like a primary care office.
I'm just going to check your eye again.
Where it is really your basic illness and injury treatment. The primary care office then does the wonderful job of taking you, the patient, the whole person, and saying, how do we take care of you so that you can be the best you can throughout your lifetime? A primary care physician, I heard this one time and I think it's so true, it's the quarterback of the team, right? So the primary care physician knows where you need to go, they know how to make you, what the playbook is, what's best for you, and how to make you successful to win, right? So they really are the ones that know everything about you, and you really need to make sure that you have a relationship with a primary care physician, because there's going to be times in your life when things might not be going well with you physically, emotionally, your family. You need someone that you can trust and go back to, and that they can lead you in the right direction. So that's really what primary care physicians do.
Keep your head still.
We know that if we can get to you early and help you prevent disease and move towards wellness, that benefits not only the individual, but actually benefits the community. Because then the community has highly productive, highly happy, satisfied people who are working in the community to the highest of their functionality. There's always going to be a place where we're going to need acute care facilities. But if we can do our part as a health system, as part of our community, to help prevent that, then that's what we're really doing good work.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by Choose New Jersey, Gary's Wine and Marketplace, New Jersey Resources, MD Advantage, the Give Something Back Foundation, NJM, and by the New Jersey Office of the Insurance Fraud Prosecutor. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.